Greetings! I am Bheron Reyes, and I'm going to demonstrate surgical hand washing or hand scrubbing, which is a type of hand washing used in the operating room. The purpose of this is to remove soil and most transient microorganisms from the skin. So the first procedure is to inspect hands for cuts in the skin and cuticles. Do not scrub if there are open lesions or breaks in the skin, because breaks in the skin facilitate development of infection. Next is to remove rings, cheap nail polish, and watch and then push long sleeves above the elbow. This is to decrease the resident and transient microorganisms. Next is to put on cap, shoe cover, and a mask to prevent introduction of contaminants into the environment. Since the cap and the shoe cover is unavailable, let's just assume that these equipments are already worn. Use deep sink with wide foot pedal to prevent the hands and forearms from touching the soiled surfaces. Ideally, these sinks are used in surgical hand scrubbing or hand washing, but then this sink is the only available use for this procedure. Turn on water using foot or knee control and adjust water to be comfortably warm, because warm water removes less of protective oil from the skin than hot water. Next is to wet hands starting from the tips of the fingers to forearms, keeping hands higher than elbow, because water will drain off your elbows, flowing from the cleanest area to less clean area. Open a pre-packed scrub brush to remove resident bacteria from the skin surface. With brush on your dominant hand, using a circular motion, scrub nails and all skin areas of non-dominant hand and arm. The circular motion will mechanically remove microorganisms. Scrubbing the non-dominant hand first sets a routine you can remember to prevent contamination. Scrub each area in 10 strokes. Don't forget your finger nail. Repeat actions on your dominant hand and arm. And then the forearms. And then your elbows. Keep the hands and arms above elbow level, place the fingertips under the running water, and thoroughly rinse the fingers, hands, and arms. Allow flow of water from the area of least clean hand, which is contamination, to the area of the most contaminated elbow, which is the elbow. Remember that your hand must not touch to the faucet. Keep arms flexed and proceed to the operating room. This prevents water from flowing from the least clean, which are the elbows, to the most clean area, which is the hands. Secure a sterile towel by grasping it at one edge, opening it at full length, making sure it does not touch your uniform. This is to maintain the sterility of the towel. Dry each hand and arm separately. Extend one side of the towel around the fingers and hands and dry it in a rotating motion up to the elbow. This prevents contamination by drying from the least from the cleanest to least cleanest area. Next is to reverse the towel and repeat the same action on the other hand and arm in a rotating motion. This is to prevent the contamination of the gown. Then discard the towel on a linen hamper. In donning and removing of sterile glove in an open method, the fundamental procedure is to explain to the client what you are going to do, why is it necessary, and how he or she can cooperate. Then perform hand hygiene and observe appropriate infection control procedures. Then of course, don't forget to provide your patients their privacy. The first procedure now is to open a package of a sterile glove by dropping them in a sterile field. And dispose the outer package. Using a pickup forceps, center the inner package of the glove into the sterile field. And the inner package by only clipping it on the edge of the inner package. Even though the pickup forceps is sterile, still don't open the flap of the package in the center or in the inside of the package because it will contaminate your gloves. Then now put the first glove on your dominant hand using your middle and index finger and your thumb. Pick up the right glove and your thumb on the dominant hand should be in your palm as if it finds its way on the thumb of the glove, and plunge your hand on the glove. In gloving your non-dominant hand, use your middle and index finger to insert in the cuff, and your thumb must be away of the cuff. In your non-dominant hand, always remember that your thumb must be on the palm, and insert your hand, locate the thumb of the glove, and insert your hand. And now you can fix your glove. Remember to touch only the sterile or the outside part of the glove as your both hands is sterile now. And now let's assume that the gloves are already contaminated. In removing the gloves, grasp the outside part of your non-dominant glove or hand and turn them inside out. Crumple them and then use your middle and index finger to insert inside the glove as you turn them inside out. And then dispose. In donning a sterile gown and gloves in a closed method, the fundamental procedures is to introduce yourself to the client, verify the client's identity, and explain to the client what you are going to do, why is it necessary, and how he or she can cooperate. Then, perform hand hygiene or hand washing, and observe other appropriate infection control procedure. And of course, don't forget to provide your patients their privacy. Before donning the sterile gown, open first the outer package of the sterile glove and drop them in a sterile field. Using a pickup forceps, arrange the placement of the glove into the sterile field. Then, unwrap the outer package of the sterile gown by flipping out the edges of the package. Then, grasp the sterile gown and lift it directly upward. Step back away from the table and gently shake the gown for it to unfold. Then, slip your hands into the sleeves only to the proximal edge of the cuffs. If donning sterile gloves by using the closed method, work the hands down into the sleeves only to the proximal edge of the cuffs. Or if donning sterile gloves by using an open method, work the hands down into the sleeves and through the cuffs. Then, have the circulating nurse pull the gown upward to cover the neckline of your uniform in the front and in the back. Then, she will tie the neck and the back part of your gown. Then, have your circulating nurse to hold your waistline of your gown using a gloved hand for her to tie it in the back. Take the two ties at each side of the gown and tie them at the back of the gown, making sure that your uniform is completely covered. When worn, sterile gown is considered to be sterile from 2 inches above the elbow to the cuff, since the arms of a scrub person must move along across the sterile field. So in putting on the glove, the first hand that we will put on a glove is the non-dominant hand. With the non-dominant hand, pick up the opposite glove with the thumb and index finger, handling it to the sleeves. And lay the glove on the opposite gown cuff. The thumb of the cuff should be facing downward, while the opening of the glove should face towards the fingers. And then use the non-dominant hand, the cuff of the glove, and anchor it while the dominant hand will grasp the upper side of the glove cuff. Stretch over the cuff of the glove. Then after we put on the gloves, pull the sleeve up to draw the cuff over the wrist as you extend the fingers of the non-dominant hand into glove's fingers. So in putting on the glove on the dominant hand, place the fingers of the gloved hand under the cuff of the remaining glove. And then place the glove over the cuff of the second sleeve. And then extend the fingers into the glove as you pull the glove off over the cuff. And then just like the dominant hand, pull up the sleeves as you insert your hand. And then arrange each fingers inside the glove. In removing the used gown and glove, you just have to turn them inside out. When gloving another person or the surgeon, the first procedure is to pick up the right glove with fingers reverted and stretch the cuff. Hold the palm of the glove towards the surgeon. Then, stretch the cuff sufficiently for the surgeon to insert his hand. Avoid touching the head of the surgeon by pointing your thumbs out. And then exert upward pressure and then unfold the cuff of the sleeve. Repeat the same procedure to the left hand. In removing a sterile glove, gloves are removed after the gown. Then, gloves are turned inside out using the glove-to-glove technique, then skin-to-skin technique. The glove-to-glove technique is you will pinch the forearm part of the glove, then turn it inside out, then crumple it in the gloved hand, and the skin-to-skin technique is use your middle and index finger to insert the inside of the glove and turn it inside out. Then, discard the glove. Then lastly, don't forget to document the sterile technique was used in the performance of the procedure. In donning a sterile gown, the first procedure is to reach down to a sterile package and lift the folded gown directly upward. Step back away from the table into a clear area to provide a wide margin of safety while gowning. Then, hold the center fold of the gown and gently shake it to unfold. Locate the sleeves of the gown and slip your hands through the sleeves. Holding your hands on the level of upward on the level of your shoulder without touching the outside of the gown. Then, a circulating nurse will reaches the inside of the gown to the sleeves and pulls the sleeves over the hands to the wrists. Then she will fasten the back part, ties the waistband, only touching the outside of the gown. In gowning another person or the surgeon, as the surgeon enters to the operating room, provide or give her a sterile towel and be careful not to touch her hand because you will be considered as unsterile. Then, unfold the gown by holding it at the neckband. Hold the shoulder part of the gown and introduce the whole of the gown to the surgeon for her to slip her hands through. Release the gown and the shoulder part of the surgeon because the back part of the surgeon is considered as unsterile.
Then, the circulating nurse now pulls down the gown onto the shoulders and adjusts the sleeves and the cuffs.
In changing gown during operation, a circulating nurse will unfasten the ties of the gown and the neck part and the back part. Then, grasp the shoulder part of the gown and turn them inside out. The gown is always first removed before the gloves. Then, if only the sleeves is contaminated, a sterile sleeve will be put on over the contaminated one. Preferably, a sterile team member may gown another. If it is not possible, step aside and put on another sterile gown.